All right. Hey, guys. So, for those of you who know me, I mainly treat children. That's mostly what I'm teaching about and all that. There is a concept in pediatrics, though, that is salient for adults to some degree. We'll see how practical this is. But there is this notion of something that occurs to humans during pregnancy, which is called fetal toxins. Okay, so what happens is during the pregnancy, while the child is in utero, any heat that the mother encounters, that any heat that the mother generates internally, that heat can and does affect the fetus, affects the child. Okay, so what are we talking about here? We're talking about things like, I mean, the most common one of the most common things that you would think of in this context would be like stress, right? So many moms, pregnant women, they already have kids, and we all know how the American lifestyle is with kids. It's pretty hectic. They may or may not be working, right? And work is never not stressful, right? So just stress to the degree that you essentially have kind of this liver qi stagnation effect combined with some kind of liver heat, the degree to which we live in a society where heart heat is a consistent problem, even at low levels, just the overstimulation of our society, may create this heart heat. So then you start thinking about things like media input, right? And the degree to which that media input, for example, or just simple things like driving, yeah, would cause us to get stuck in sort of a stress state of mind, right? So to be stuck in fight or flight, this sympathetic nervous system dominant situation. Well, in all situations, this eventually will produce heat of some kind, right? It doesn't have to be liver qi stagnation leading to liver heat, leading to liver fire coming out, or something like that. It can be this more low level kind of just constant kind of consistent heat, and even heat is affecting the heart, right? So it's something of a modern circumstance to some degree, right? But these circumstances create a situation where the mother has some kind of heat, and that heat gets into the child. So what are we talking about here? Like stress hormones, androgenic hormones, these kinds of things that we associate with chronic stress states, right? How about another modern circumstance, in some sense, an entirely modern circumstance, chemical exposure? In traditional circumstances, maybe like cooking fires, and you're exposed to to smoke and that kind of thing, that burn off. So, this is a form of pollution, right? So, but in the modern circumstance, air pollution, water supply pollution, food supply pollution, all of you guys all know the litany, all of the different things that we eat and drink and breathe, things that we put on our skin, whatever it may be, these toxins essentially getting into the system. Well, that also, in theory, could affect the baby. Then things, somewhat less common to some degree, which is like things like smoking, drinking, drugs. Things like if the mother gets sick during the pregnancy, especially if she has a fever during the pregnancy. Not that this is super common, but this is one of the things that's considered here as far as anything that increases heat in the mother can increase heat in the child. How about things like diet? So, especially diet stuff that doesn't agree with the mother. So she may be eating allergens, things that we would consider in Chinese medicine, like gluten and casein and these kinds of things, that we would consider dampening, and then the damp turns to heat very easily. That in a Western context you would notice as sort of allergic reactions, food intolerances, these protein intolerances related to gluten and casein and other things, right? But it could be even things like just extreme diet, like eating really spicy food with ice cold water, just these extremes that can produce heat by themselves. That, for example, just eating too much spicy food. So anything that causes heat in the mother then can lead to heat in the baby. And this heat in the baby, they're called fetal toxins. Okay, baby is born. Now this baby has something called fetal toxins, and the baby, the heat that's inside the baby's body will attempt to express itself, to get itself out, right? And so where we most see this is in skin conditions. Okay, so things like, children that are born with cradle cap or develop cradle cap really quickly, children that are born with eczema or develop eczema within the first couple of months of life. I actually feel like it's quite possible that all eczema, I don't care when it develops, can be likely due to fetal toxins, but this is somewhat of an aside. Any of these skin conditions, things like infant acne, right? So in the case of infant acne, why are they getting a disorder that we associate with puberty, right? Well, maybe the baby's body has these androgenic hormones like testosterone, stress hormones, and things that the baby's body is attempting to conjugate, get rid of, clear, and process, and it's leading to acne. But the consistent theme that underlies all of these skin conditions and ultimately the fetal toxins is this inflammatory state in the skin, right? And that in Chinese medicine, we would consider this as being the pregnancy, the mother had heat, the heat got to the baby is born, and the fact that it's showing in the skin means that the heat is in the blood. Now, this is a separate conversation, but in dermatology, we often say, oh, all these dermatology conditions, many of these dermatology conditions are heat in the blood, right? And this is just sort of said as a matter of course. You just sort of, okay, heat in the blood. Well, what is this heat in the blood? What is the blood? Is the blood a place where you can put things? Is this different from heat in the blood that creates erratic bleeding in women during their cycle? What is this heat in the blood, right? So the way they talk about it, it would almost seem as if the blood is in fact a place where you could sort of put something, that heat could exist in the blood that isn't only related to the uterus, that it's this other factor in the body. So we're going to come back to this. So the baby's body is trying to clear this heat through the skin, right? Which is never preferable. That's not exactly how you want that heat to be cleared. The body should just clear that heat without you noticing it. The fact that it's coming out of the skin is almost like a mild emergency mode for the child or for anybody with skin conditions. It's not how your body wants to do it, but it's how it will do it if it's a bit overwhelmed, right? It'll come out in the skin. So here then, we say, okay, this child has fetal toxins. No child escapes this. Every child has it to some degree, right? Every child has it to some degree. The fact that it's coming out in the skin is a good thing. And ultimately, it needs to, in the concept of Chinese medicine, these fetal toxins need to clear the body completely. And the way that your body actually fully clears these fetal toxins is via diseases, respiratory diseases that have a rash associated with them. So you think about things like chickenpox is an obvious one. Measles would be another one. Another one could be what's called post-viral exanthema. So a child gets a virus, and then they get better, but their skin breaks out all over their whole body. The skin breaks out in these small red bumps that sometimes people will mistake for something like scabies or something, but they're not itchy, they're not bothersome. It's just all over the whole body, these tiny red bumps, and they just go away. They can go away in a couple weeks. They could go away in 2 months sometimes, depending. But in Chinese medicine, in a sense, the human body has a symbiotic relationship with these viruses, such that the virus sort of gets a place to reproduce and play, and then the body then is able to clear these fetal toxins vis-a-vis the rash that's being expressed via this viral infection. And I've been told, and I've seen it a little bit, I haven't reviewed this literature as strongly as I might, but there is some research for example, in the Lancet showing that, for example, people who have had the measles that has a rash associated with it, that they actually do have better health outcomes, isolating for many other factors. They have better health outcomes generally, lower amounts of disease of all different kinds, whether skin conditions, asthma, up through heart disease, and these kinds of things. that in general, because what they did is then they tested against, or they researched against, a group of people who had had the measles confirmed with no rash. So the rash was the decisive factor there, that if you get the measles that has the rash, that the rash somehow provides some kind of benefit. Well, in Chinese medicine, this is easy for us to understand. And what you have to understand about this is that, furthermore to this concept of fetal toxins, is that if the body does not clear these fetal toxins during childhood, that heat stays in the body. And the way that Chinese medicine conceptualizes this is they say the heat stays in the body all the way through adulthood, all the way through old age till death. You will just carry that heat around. And that what it does is that it waits for other diseases to activate it, such that the thinking is that whatever else you get, whatever other factors, patterns that are, from a pathomechanical point of view, that if you have lingering pathogens, if you have heart heat, if you have liver heat or something like that, whatever it is, the pattern that you have, that you sort of live with over the course of time, that pattern will be made worse by the presence of fetal toxins. So if you have a lot of heart heat, in theory, then that heart heat would be made worse by the presence of fetal toxins, so that such that the likelihood of something like a heart disease, like a chronic sort of heart disease, would be far more likely in that situation. And this is what Chinese medicine posits about this, that the heat stays in the body, and that any other factors that are in the body, like dampness or something, you have some dampness in your body, it's much more likely to turn hot by the presence of these fetal toxins. By themselves, the fetal toxins don't really present so much of a problem. It's more when they're mixed with some kind of chronic thing that you have going on. So what we said before about the skin in this situation is that the fetal toxins look like sort of a chronic inflammatory disease. Okay. So if we're not clearing this inflammation, this heat, these fetal toxins in the body, and then they're staying in the body through adulthood, well, now this is considered to be problematic, right? And in fact, Chinese medicine does have a theory about, or a name for this problem, which they call deep-lying heat pathogens, right? And we're not going to get into that so much right now, the nature of deep-lying heat pathogens. But if you think about what this sort of chronic inflammatory state is, that suddenly gets really interesting from a Western perspective, sort of from an integrative perspective, because, all you have to do is sort of start reading about inflammation, and you could pretty quickly satisfy yourself that, most major diseases in the modern era, really, chronic inflammation underlies so much of this. Right? You talk about cancer, you talk about heart disease, number 1 and number 2 killers, number 2 and number 1 killers, whatever, in the United States, right? You start thinking about autoimmune disorders, you start thinking about brain disorders, you start thinking about many, many, many different things, and inflammation starts to, there's people who are designing their whole practices around the nature of, from a Western perspective, this notion of underlying chronic inflammatory conditions. Well, so what about it, right? So this notion, the thing about it in Chinese medicine is that this was not common in China for sort of adults to have deep-lying heat pathogens sourced from fetal toxins that they didn't clear, because they weren't getting that many fetal toxins, first of all. Second of all, they were much more exposed to respiratory diseases, and therefore were much more likely to have cleared the fetal toxins that they have. So then what happens is because Chinese people weren't so much exposed to this issue, there is not a lot of literature in the Chinese literature. There's not a lot of discussion traditionally around, like in sort of in a pre-modern context, there's not a lot of discussion around deep-lying heat pathogens in adults. what they are, how to find them, where they are, how to clear them, how to prevent problems, rather than waiting for them to come. All of this discussion that you would expect, like, for example, we have, respiratory diseases were very common, and you have, thousands of years of discussion around respiratory disease because it's so common. But in this case, because it's not common, there's not a lot of literature about it. They just weren't arguing and theorizing and opining and critiquing other people's theories. It just wasn't happening because it wasn't common there, in pre-modern China. So now what you're starting to see is sort of a revival of this kind of from an integrative perspective. People are looking at inflammation, they're trying to apply that to Chinese medicine, they're sort of extrapolating backwards towards this question of deep-lying heat pathogens. And so again, we're not going to talk about that here. We can talk about it at a later date, but what I'm interested in, because I do pediatrics, is sort of nipping it in the bud with the kids that I treat, right? So understanding when I'm seeing it and all this kind of stuff, how to clear it, and with the assumption that, okay, if we can clear this as much as possible in childhood, then, in theory, this would make for healthier adults. That's a long play. It could be another 80 years before I'm satisfied that really helped. But that's what Chinese medicine is, isn't it? You're making these long plays, especially when you do pediatrics, you're thinking to the future. Even you have patients coming in that are 40 years old. I'm thinking about them for when they're 60, for when they're 80. What underlying patterns do they have now that will develop into something later? Let's try to nip that in the bud. Let's try to head that off, before the pattern really gets a lot of traction and a lot of sort of forward momentum. Try to slow that down. Well, the easiest time to do that is in childhood, and so I'm interested in this. So what comes up around all of this question is when you think about the nature of something like chickenpox and the measles. It was common to get those. Chickenpox, of course, everyone was trying to get chickenpox. Let's just get it out of the way so you don't have to deal with shingles later. Or just deal with contracting it later at a later time in life. It's much more, it's not pleasant to deal with chickenpox as an adult. So just get it out of the way. Same with measles. Measles traditionally was not considered the way that we consider measles now. Is very scary or something like that. It was not considered so. So parents would actively try to have their kids get the measles, get it out of the way, right? But what do we do now? In the modern era, what are we doing now? We're actually vaccinating against both of those diseases. Now, the thing is that the vaccination doesn't necessarily prevent children from getting those diseases, as everybody learned with the coronavirus. What it does is, in theory, it makes the symptoms less and stuff like that, right? So you're still going to get the measles because it's wildly contagious, but your symptoms will be decreased. But the big thing that the vaccinations seem to do around chickenpox and the measles is they tend to suppress the rash. So in that case, the one thing that we as Chinese medicine practitioners sort of want from the disease is the rash, is the one thing that's being suppressed by getting the vaccine. I mean, and they do work. You just never see it around here where I live. Everybody's vaccinated against both, and it just you don't. Kids aren't getting the rash. You don't see it around at all anymore. So if we are giving a medicine that is supposed to be preventative, that has a tendency to prevent the child's ability to clear fetal toxins, then this would be an argument, at least a theoretical argument, that in theory, that vaccinations for these two diseases could actually lead to problems later vis-a-vis this notion of fetal toxins. That we may be causing the body to maintain a relatively high level of inflammation through childhood and ultimately through adulthood that is ultimately problematic as we get older, as our immune systems begin to shift and change and become weaker, and as we get then these things start to gain a foothold and all that. So this is the basic notion of it, this idea of the question of vaccinations, right? Like I said, I do a lot of pediatrics, so parents are constantly asking me about vaccinations. What do I think? This and that. And everything depends on where you live. Like I live in California, so it's mandatory if you want to access certain education, public education, it's generally mandatory for that. So it's a question, right? Because a lot of the times, the kinds of parents who are seeking me out are also the kind of parents who would tend to want to have control over their child's body in terms of the vaccination. I'm well aware of many of the different arguments that go either way in this situation, and it's the arguments about the research and all these things are just totally not interesting to me. Personal opinions aside, all of these things. Just so you understand where I'm coming from on this, is the way that I run it in my clinic is if a parent comes in and they want to know, hey, look, what should I do about vaccinations? My thing is like, look, whatever you ultimately decide, I can support you in that decision to the degree that I'm able. If you want to vaccinate your kids, but you're worried about potential side effects, we can do acupuncture. I can give herbs that can help to prevent and ultimately clear any side effects that might occur that they're worried about, generally inflammatory side effects. Because when you look at and this is just the perspective of what I see in the clinic a lot, is that vaccinations, most kids, you're not seeing any problem, side effects at all, at least not in the short term that I see with my own eyes. Again, now we can argue about long-term inflammatory effects, long-term heat, and all these kinds of things. But in the short term, what I do see for a lot of kids is that vaccinations do seem to affect the immune system such that they are getting what we would call in Chinese medicine lingering pathogens. Right. So a lingering pathogen, among other things, is basically a child gets sick, then in some way or fashion, they don't get better. So maybe they get sick and then they're 100% better, except for a runny nose or a stuffy nose, and it just stays. They get sick, they get better, except for a cough, and it just stays. Or you have other kinds like ear infections where they get sick, they get the ear infection, then they're 100% better, and then every time they get sick, it's an ear infection. So this is another kind of sort of lingering pathogen. You could have things like asthmas, where kid gets sick, they get asthma symptoms, wheezing, difficulty breathing, cough type variant, and then they get 100% better, and there's no breathing issues at all, and then when they get sick again, then it comes out again. So now every time they get sick, this is coming out. In some kids, they get sick, they have the wheezing, and then when they go to play in the grass, play soccer, run around or something, the lungs heat up, and the symptom comes out. These would be considered different types of lingering pathogens. Another type could be something like a mono, right, where somebody gets sick, and then it looks like a respiratory disease, and then it kind of morphs into a whole other thing. Right, so what we would call sort of the chronic long-term phase of mono. This would be another kind of lingering pathogen. So you can see here, there's at least 3-4 different kinds of lingering pathogens, and that it's pretty obvious to me that for a lot of kids, not all kids, for a lot of kids, vaccinations do seem to make that worse. That the incidence of what we call lingering pathogens, latent pathogens, hidden pathogens, Xiaoyang disorder, these different names for different types, the incidences of that do seem to increase in the presence of vaccinations. So, it becomes a question of, what's happening there. So the degree to which then a kid has fetal toxins, then you put any kind of vaccination in there. And how is that vaccination interacting with that pre-existing inflammation? Is it causing more inflammation? Well, what's going on there? These start to be questions, right? So again, I'm not interested in the debate around this. I'm sort of interested in the mechanics around this. Okay. So this is what I see in my clinic, among other things, is the tendency towards the main side effect from vaccinations. Not that this is every kid is getting this, as I said, but that probably the main sort of side effect that I would see is lingering pathogens. So sort of like maybe like a chronic inflammatory situation based in the respiratory system, or some kind of immune modulation that occurs that is mostly affecting the respiratory system. So this then is sort of this notion of fetal toxins being a normal process, although maybe to some degree more severe in the modern context. Then the baby is born, and the first thing that the body does is attempts to get rid of those fetal toxins via the skin. Then we have a process of, this is all described by Chinese medicine, not by me. Then we have a process by which the body then interacts with a virus and further clears, hopefully entirely clears, these fetal toxins. And then that sets the child up for a healthier life. And that what I would argue is that then what we see, and it's not what I'm arguing actually, it's what the literature argues, is that when these fetal toxins don't clear, then we're seeing something called deep lying heat pathogens, which I will do another segment on. But these deep lying heat pathogens, as described in Chinese medicine, are this inflammatory process, a chronic inflammatory process that makes other diseases worse. I mean, from our perspective, maybe it's enough that it creates its own diseases. At least from our perspective, that pre-existing deep-lying heat pathogen will interact with whatever your chronic patterns are. Chronic stomach heat, yin deficiency heat, liver qi stagnation, different kinds of qi stagnation specific to channels, right? So you start thinking about things like breast cancer and these kinds of things. You start thinking about things like prostate cancer, organ specific things, channel specific areas of the body. Where does this inflammation have a tendency to show up more often with more intensity in certain areas? These start to be the questions that surround this for me. And this is a much bigger question. I'm leaving all of this very open at this point. What I want to do here is just describe, sort of from an introductory perspective, how we view how these things get rolling, right? In a later thing, we'll talk about actual deep lying heat pathogens and what those look like in adults, how these different things operate. But anyways, all right. Sounds okay? Okay, you guys, take it easy. Reach out to me if you have requests. I recently saw that somebody had a request for lingering pathogens versus goo therapy, which is a quite interesting subject, and I will make a thing about that. If you have requests, hit me up. I want to hear from you guys. If you like the podcast, hit me up. I want to hear from you guys. A few of you have reached out over the last year or so. Please reach out. Give me a request. I'm happy to take them. In the meantime, you guys take it easy. All right. See ya.